Hello, good afternoon. I'm Veronica Montgomery, and I'm the Clinic and Patient Liaison Consultant here at the Fertility Hub. Thank you very much for joining me for part two of the Crisis Management, Marketing and Communications seminar. I'm just going to share my screen with you and then we can start the presentation. I can just do. Okay, I think you should be able to all see that now. So throughout the current COVID-19 situation, every Wednesday in the section Managing an IVF Unit, I've been writing a blog that covers all aspects of crisis management, marketing during this strange period, and communications. So I did a presentation last month, and obviously there's been too much really. We're on, I think, week 14 of the blog series now, so it's just easier, I thought, if I do these 40-minute summaries just to explain what the blogs have spoken about. And obviously every week something is changing, our situation is completely fluid, so I think it's good just to add in these extra bits at the end of the month and give you a bit of a roundup. So today's presentation is going to talk you through my background and the background of the Fertility Hub. We're going to look at protecting your brand, online marketing, online seminars, and the power of newsletters. So background, I started my career at the Royal College of Nursing. I worked there as advertising manager across their 8 nursing titles. I then moved across the fence from the media to the media buying side when I was director at Kingsway Advertising, and we specialised in health marketing for NHS trusts here in the UK. I then moved to the Caribbean island of Barbados, and I was a marketing consultant for 15 years at Barbados Fertility Centre. I had the idea to start the Fertility Hub because as a media buyer, I recognised that as an industry, there was two vital things missing, I thought, and that was a patient-focused website that had fresh content and wasn't static and not just a directory of places where you could advertise. And my second point was that being in the industry, there were very few places that focused on all aspects of managing an IVF unit. So I had this idea, and then I was constantly too busy doing my main job that I never had time to get on with this. So in December 2018, I left Barbados Fertility Centre, and I then spent the new year from January to March getting the Fertility Hub from up here to out there. So the Fertility Hub essentially is a publishing platform that brings together both patients and healthcare providers under one umbrella. On the patient side, we currently see 15,000 patients a month who come to the site. That took a big leap throughout the lockdown period and the shutdown of clinics because patients were desperately looking for anywhere they could go and have their treatment. But as the governing bodies such as ASRM and the HFEA and the British Fertility Society all issued guidelines suggesting that clinics should actually close down and that fertility treatments were elective and not important during a health crisis. This obviously led to great devastation for the patients, and thankfully the clinics were closed for 2 months, but many clinics have now reopened and there's a gradual easing of the lockdown going around the world globally. Then from the main site, there's a gateway through to the back room, as I call it, which is the healthcare providers section of the site. You have to register to use that. We have over 5,000 healthcare professionals working in assisted reproduction who use that side of the site on a regular basis. So the site itself launched in March 2019. And if you haven't been and had a good look around on the healthcare side, then that provides you with this section, Managing an IVF Unit, which is weekly blogs on all aspects of IVF unit management, but specifically we've been focusing on the current crisis and the marketing and communications methods, because that's your sort of biggest area to worry about now, is communicating with the patients. There's also research update, supplier update, and there's a platform to not only advertise your vacancies, but also to register if you're looking for a new position in assisted reproduction. And obviously there's the healthcare news as well. So the previous seminar covered crisis management itself, marketing and communications, the financial implications of COVID-19, and the use of PR. Okay, so moving on to my first section today, which is protecting your brand. And really your brand is the clinic's perception of your clinic. So as I've illustrated here, perception is all in the way you look at things. And for this image, you either see a silhouette of two people or you see a white vase on a black background. This moment, the most important thing is what are your unique selling points. We are going to have a very tough time now as clinics are reopening. The landscape looks very different to what it did when we closed down 2 months ago. So you really need to focus on what those unique selling points are, your USPs, and really highlight what makes your clinic unique, because the competition is going to be tough for patients. The pool of patients is going to be less as well as we're faced with the global downturn in the economy. And the key messages that you must reiterate are your patient care, your compassion, and most importantly, the support you can offer them during this time. Only send COVID emails when they're about your operational changes. People just switch off now. They've had months of it. And, you know, we're still just all trying to come to terms with what a huge shock this has been. And make sure you update your website on your operational changes, and also update Google My Business so that your operational hours and your phone numbers are relevant if you've made changes in that department, and your opening hours as well. Okay, something I've spoken about a lot is that fighting COVID-19 from a commercial point of view and trying to protect your brand. The whole team needs to fight the fire that is COVID-19. This isn't just, you know, a marketing and communications problem. It's for the whole team to get on board. So keep your social media updated with any operational changes you've had. Be extra helpful now. And again, this is where the whole team comes in. We know the nurses are very compassionate. We know the nurses have to hold the patient's hand, answer 1,000,001 queries. And, you know, they do so with good grace and understand that for every infertility patient, this is their life, and it's a very traumatic journey. And you want to make it as stress-free as you can in terms of their handling of clinics that they deal with. That you want yours to have handled it the best. So be extra helpful. In order to stay trading, stay focused on patient care, and emerge from this stronger in the patient's mind. We know we can do more, and that's why marketing is so important, to let your patients know what we're doing to ensure that your clinic is COVID secure, and explain all the different operational changes and what their treatment is going to look like now, because it would look very different from when they booked it maybe last year, or they were due to come out to you in March and had to be rescheduled. Now, a strong brand values its employees, and by looking after your staff, your reputation will follow. So if your staff are very happy in the environment in which they work, this will come across to the patients. And again, we've spoke a lot about transparency and communicating with your staff. So as managers, it's your job to put a communications policy in place now that communicates to all your staff, whether that be, you know, once a week, maybe midweek, there's a management meeting. Update your staff what was discussed in that management meeting, because you never know who in your team might have that bright idea which could save your clinic during this crisis. And also make sure there's a communications policy for patients as well. Now we move on to the next section, which is online marketing. And there is a new reality calling, and it's up to us to decide whether we accept that call and rise to the challenge, or whether we decline it and try to carry on marketing as we were before the crisis, because it's everything has changed, and it is changing weekly. So as I said throughout, marketing is not a cost, but an investment in the future of your clinic. I appreciate that clinics closed down for a couple of months. That revenue stream isn't just a case of we can make it up. You know, you can't make it up, because now going forward, you'll never get that time back. You're going to have less patients coming in, which means fewer cycles each month. And that revenue essentially is gone and lost and isn't coming back. So I appreciate there has to be costs, and usually that comes from the marketing budget. And I've just argued throughout that it's never been more important for you to be visible and marketing at this time. Competition will be tough. Use this time to invest in your SEO. And one way to check how your site is doing is to check the page health of every page on your website. And that will highlight to you what's a bad page, what's a okay page, and what's a very good page. You want to get every page on your site very good for SEO and ranking when somebody searches for IVF treatment. And it is, you know, there's a lot of competition out there for those patients. Build relationships with other organisations, not necessarily in competition with you, but then there might be other doctors that you have working relationships with. Have backlinks to their site on yours and vice versa. Also, you can work with governing bodies, basically anybody associated with fertility. Try and have some kind of relationship with them and share content. You share their content on your site, and again, vice versa. It's really important to keep on top of your Google Analytics right now. For a start, the user device has changed dramatically. So we went from seeing the majority of users on their mobile, and this coincided with the commute to work and the commute home from work. That switched to desktop because so many people were working from home and not doing the daily commute. And this means the Google ads you're running, you need to specify which device you want your ads served on. So make sure that you're advertising where your patients are going. Again, we're at different stages throughout the world. So, you know, depending on where you're targeting patients, some will still be in lockdown, some are in easing of lockdown, some are still working from home, but lockdown is easing, which is the case we're in the UK because all our schools are still shut. So many people are still working from home, and offices aren't reopening yet if it's a job that can be done from home and not a physical job. Also, because you might be marketing in different countries, set up alerts on your Google Analytics for any government announcements in the countries that you're looking to target patients. So it's important that you know when they can travel and when they're out of lockdown, and what their COVID-19 situation is. So yeah, just make sure you're on top of the trends, and that your ads are being seen. We can't afford any wastage at this time. Also, know your social media platforms that are most likely to reach your target market of patients. It's a great time to get more bang for your buck. A lot of these social media sites and Google operate on an auction system, and fewer advertisers equals to you that you'll be paying less for your advertising because it's an auction, and be getting a lot more audience for your money. Here I've just written Pepsi versus cola. That's the old thing, you know, you either prefer Pepsi or cola, you prefer Burger King over McDonald's, and it's the same with social media. People have a preference of which social media platform they use the most. So you need to be using all of them in order to reach as many patients as possible. So don't just use the ones that you personally like using. I'm going to give you some demographics now on who's using which platforms. Okay, so this first slide just looks at the age of patients, and infertility patients, your target market is aged between 30 to 49. So the highest platform for reaching users in that age group is YouTube. And again, now is a good time to put out quite a lot of content. You can explain your operational changes via YouTube. You can conduct interviews with your medical staff. And again, no, everybody's used to seeing everybody working from home now, so it doesn't have to be very fancy and corporate. You can just do talking head, like I'm doing this presentation to my computer now. I just hope there's people out there and I'm not just sitting here talking to myself. Okay, so YouTube's the highest one, so make sure you post regular content on your YouTube channel, closely followed by Facebook. And interestingly is the amount of users that's gone up on WhatsApp. I've included WhatsApp as a social media platform, and I'll come on to that at the end as to why I think it should be included in your marketing mix. Okay, the next slide looks at the average earnings of the users as well. Again, YouTube far outstrips everyone. So again, that's one of the criteria we want, that these people can afford to access treatment. And again, closely followed by Facebook, and then LinkedIn as well, which we would expect because it's a professional social platform. And I have to say, Instagram is rising as well, in both income and age. Rising as in the criteria of the age we want to meet, the 30 to 49, is getting more users in that category. Okay, and then also there's been research to show that female infertility patients are very keen on their social media. They're a very active group on social media, and with the men, they tend to do the Googling and do the research. So men have now overtaken our visitors on the Fertility Hub, which is quite interesting. So it seems that the female partner goes off and looks at social media and engages in support groups and forums, and does her research on clinics, then discusses it with her partner, who hits Google. So the men hit Google. Okay, so again, Facebook, very strong, 75%, followed again by YouTube, and then they break down. But again, you see WhatsApp's nearly up there with Instagram. So that's quite interesting, that the growth of WhatsApp during this time as well. And then this slide looks at where they're based. So this is for USA users. Again, very strong, Facebook and YouTube. LinkedIn, again, quite strong. And Instagram is starting to rise there too. In the UK, what's very interesting is the majority of users on Snapchat. So that's coming out very strong. And again, YouTube and Facebook, quite similar as well. And then I've just done a little slide to talk about WhatsApp in particular, because there's been a lot more people using WhatsApp during the COVID-19 crisis and being in lockdown. So WhatsApp was bought by Facebook. It was a paid download, so you paid $1 to download it. And when Facebook bought it, they scrapped that and made it a free app with the hope of growing the users and the audience, which they have done. You can use WhatsApp for patient inquiries. The patients love it. Quite often I get messages either via the website or via our Facebook page, and immediately they give me their mobile number to have a WhatsApp conversation with them. So it's well worth having a dedicated WhatsApp number in your clinic, and then you can allocate who's in charge of checking those messages and having those conversations with the patient on a day-to-day basis. Now, what's interesting is WhatsApp now has a status feature, which works like stories on Instagram and Facebook. And so that way, by starting to use that and updating your status as the clinic name as opposed to the individual nurse. So do make sure you dedicate specific numbers for WhatsApp usage, because I don't think your nurses will be too keen to give out their personal mobile, or the doctors to be receiving WhatsApp messages from patients in different time zones throughout the night. So yeah, have those dedicated numbers. But there is, interestingly, an e-commerce version coming for ads, and that should be out within the next few months. So growing your WhatsApp audience now and starting to use that as a messaging platform and start sharing statuses, because it's very much coming into our marketing mix. As I said, we're trying to save money at the moment. But online marketing is probably where you should be spending a little bit more, because lockdown saw a 30% increase in the use of web traffic, in the increase in web traffic globally, throughout that period. What you also want to be looking for now is added value. It's not a case of we're going to plan a campaign, we're going to push launch, and then we're just going to do the data at the end of the month and see how well that performed. You really need to be trying to get a bit more, and anywhere where you're directly advertising, something like the Fertility Hub, be asking for added value. We've actually overhauled our entire media pack now to include seminar sponsorship, podcast sponsorship, and opened it up with banners available on certain pages on the site, just because we appreciate we have to be more flexible. I always wanted the site to be very clean, and I don't intend to have more than one banner on one page, because I hate pop-ups and I hate things dropped in the middle of a story. I think, you know, we've always led by information and education, and whilst I want to keep that, I do appreciate that we need to offer more value for money when advertising on our site. Interestingly, because of lockdown, then I say there's been an increase in web users. Offline patients, so people who may have found you through more traditional media, and aren't that tech savvy and didn't spend a lot of time online, do now. So get engaged with those prospective patients. If you ask, where did you hear of us, and they are a traditional method patient, you'll probably find now they've moved into your digital footprint as well. So make sure you engage with them, do an outreach program, so whether that be enrolling them on your subscription to newsletter, because you'll find that now they are online and you can get a lot more of your messaging across, and engage them in your online content. So maybe the seminars we're going to talk about in a minute. And finally, just remember, even grandma is using Zoom now. So even the most sort of die-hard, I don't use the internet, but everybody's got online now. Okay, so online seminars, these are really important right now, especially in our current climate, because seminars build trust amongst IVF patients. And in this unstable economy, your patients must trust you. They're not going to go to a clinic they don't feel they have a personal relationship with. The great thing about seminars is that infertility patients are information hungry. With air travel still being restricted, online's a great opportunity for you to engage with those overseas patients, and also you're not able to get on a plane and take your medical team to them and hold a one-day seminar. Because of the air travel restrictions, we introduced the Fertility Hub payment plan, which allowed patients to pay for their treatment monthly. So they could plan now and say, I'm going to come in 12 months' time, I'm going to come in 18 months' time, I'm going to come in 24. This gives them easy monthly installments to pay for their treatment. How we've done that is basically the clinics who advertise with us have been given the option of would they like to join the programme. And then when patients inquire to us and ask about the cost, and we ask them if they're worried about paying for treatment, would they be interested in clinics who are offering the payment plan? And then those that are, we obviously pass on to the clinics who are participating. The other beauty of online seminars is the very little cost involved. It's essentially your time and the time of the doctor doing the presentation and planning the content. So for you as the managers, actually planning that series of content, and for the marketing department to advertise those. Whilst we can't do the presentations in person, we can still do them in real time and take live questions. And infertility is, again, a content-rich subject matter, so there are plenty of things for you to talk about. I know here at the Fertility Hub, we've got over a year's worth of seminars already planned, because there's always something to talk about and something to explain in a bit more detail via a seminar. Get people to register for your seminar so that you can capture that data. But do remember, if you are capturing data for anybody based in Europe, you must be GDPR compliant, and that is that they must have given their permission to join your database, and also you must have a terms, conditions and privacy policy of what you will do with their data, and that, you know, confirm it won't be shared with a third party. Remember, your seminar is not a sales pitch. At the moment, research is showing that people really are feeling quite vulnerable, and probably especially as infertility patients who are already anxious. So check your messaging, make sure you're not doing a hard sell at the moment. It's all about education and information giving. Ways to host your seminar: use various platforms such as GoToWebinar or Zoom, like I'm using now. But then I actually really like the live premiere feature on YouTube. So that seems to work quite well, that you can set a time that you're going to launch your broadcast, and have everybody in a waiting room. And the beauty of YouTube is, of course, it stays up there for years to come on our channel, so it's always there for people to watch if they missed the first announcement that the presentation was going to take place. I'm also finding at the moment, don't set anything too far in advance. People can't retain it. We're not living a normal life. The diary's got dust on it because we're never going anywhere. And so you tend to get out of the habit of looking in it. So don't set things too far in advance. I find just keep reminding people via email, and of course do send them the link to join. And again, after the presentation, if they weren't able to make it, record your presentation so that people can watch it again after the live event. And always more people will register than actually turn up for the live event, and that is because people forget, or something else comes along in their diary that they can't actually make it. So again, try and set the times for your seminar outside of regular working hours, because people are still trying to work, whether it be from home. They still have, their boss wants a meeting at the same time. So just make sure you capture that data and do record it so you can share it afterwards. Okay, this is the last section of my presentation for this week, and that is power of newsletters. Here I've just done a screenshot of one of our recent newsletters, and that is to have an image that captures somebody to actually read the headline, and then just have a short paragraph giving them a lead into the story, and then click through to read the full story on your website. I am always guilty of having too much to say, and in the newsletters it's no exception, and I put it all together and I've got far too much in there I've covered, so I then have to go through and have a big cut, and just put across like one element from each section, because when the newsletters go out, obviously there's been daily new content, and I feel all of it is relevant to share with the patients. So try and keep them short and sweet, and as I say, I know I'm guilty of it, and I do have to go, that's far too long again, go and chop that all out. Have a valid reason for your outreach. Don't just do it because oh, the month's nearly up, we haven't sent a newsletter. Do it because you've got a reason. Sometimes I might have to send, 2-3 newsletters in a week because there's been so much going on and so many things are changing. And sometimes, it may be 6 weeks that we haven't had a lot to shout about, or there's interesting articles. But again, at the moment, just try and keep them timely, because people are inundated and they can't retain a lot of information because they're too busy worrying about job security, relatives who might have picked up the virus, them catching the virus themselves. People have just got a lot on to be anxious about at the moment, so don't overload them with information. The best things to reach out with are your operational changes. But on the other hand, it's also really important you don't ignore the crisis, because all that's saying to patients is, oh, they haven't got a procedure in place, which we know that's not true. You've all worked very hard to get your clinic COVID secure and to open again. So do tell them about the operational changes. And then also said, keep no information overload, don't put out too much, and have 3 key points you want them to retain when they've read your newsletter. Also, reach out to the patients to say, how can we best support you so that you can access treatment? That's something else that's coming out a lot, is that patients feel they need more support at this time, and especially because it's worrying, you know, treatment is going to look very different from when they booked it. So yeah, just keep it clear and concise and easy to read layout. So things that you might want to talk about in your newsletter, and again on your COVID page, would be reassurance that the clinic is COVID secure, the screening that you're doing, and I've got a slide on antibody testing in a minute, but any COVID screening you're doing for patients and staff, which will reassure them that they're going to be safe when they come into your clinic, which is a closed environment, which they may not be used to. And then explain the reduction in patient numbers, which helps your COVID secure unit. Any research you have on COVID-19 and pregnancy, that's obviously a major concern for patients. If they are successful, you know, if coronavirus is still around, how will that impact my pregnancy and my unborn child? Also, where telehealth is replacing face-to-face visits, which obviously there'll be a lot more of that, and only seeing patients for their actual treatment cycle, and obviously contact being to a minimum. And any policy changes you've made regarding payment. So for example, if you were participating in the Fertility Hub payment plan, make sure that your patients are aware of that, because that can be a real selling point at the moment. And then finally, my last slide is about antibody testing. And as we here in the UK specifically, the government were very excited about a month ago that they finally secured an antibody test. There's now been a bit of delay in production of that. During the full lockdown, when the clinics were closed, I spent a lot of time doing research on this, because I do think that antibody testing can really help us out. Obviously, we still don't know if you have antibodies, whether you are immune and how long that immunity lasts for. But what we do know is the more people we can test, the better it is for the researchers to get a handle on how much the percentage of the population that's had it. And you as clinicians can have that conversation with patients. So I've done quite a lot of research of trying to find a test that was accurate, but most importantly, the price point. The price point for tests just varied hugely, and some to astronomical per test, and also a minimum buy-in, which, you know, I just didn't think was really viable for IVF clinics to offer it at that kind of investment level, especially on something that at the moment is a nice to know. So if you did have antibody tests, it's nice to know that you've had it, you've got over it. But I just wanted to share this one with you, because I found one that comes in at a low entry level of minimum tests that you can buy, and I got it at a discounted. I've negotiated a discount for Fertility Hub customers, so clinics who go via the Fertility Hub. So we have got a discount on that for you. So this particular one is called On-Site Rapid Test. So it's inexpensive, and it is a convenient on-site test. So you do it at the clinic. It is for professional use only, and it gives a diagnosis of individuals who have been suspected to have had COVID-19. It's a 2-drop finger prick test, and then you get the results within 10 to 15 minutes. So it can all be done as part of the regular patient visit. Also, guidelines from the British Fertility Society do recommend testing of patients. So I think going forward, this will become more popular. And also, in this time where we are trying to cut costs and make up revenue stream, lots of people want to know whether they've had it. So therefore, because it's professional use only, you as a clinic can offer it to your local community, and just turn around very quick COVID testing to let people in your local area know. And again, the research programs will be very interested with your results. And then I think the main thing to add to this, I did tell you about this in seminar 1. There's been some very negative press of IVF clinics and them charging for COVID testing such as this, but charging £500 a test. So just don't overcharge for it. You know, people are willing to pay to have this done, but keep the price point realistic. That you know, you're gonna actually, you can make some revenue by testing people, but obviously, you know, make that affordable, and especially for the patients. They are paying quite a lot for their treatment already, so definitely you don't really want to be charging them much more than cost and the cost of the time of your staff for administering the test. Okay, that is the end of today's seminar. There will be another one on July the 28th, and again, which will be a summary of the last 4 blogs. I will stay online for 15 minutes to answer your questions in the comments. I'm going to stop the presentation now, but as I say, I will still be there on YouTube to answer your comments the next 15 minutes. And if you don't wish to comment, or you need to leave now, then please feel free to email me your questions, which is veronica@thefertilityhub.com. Thank you so much for listening, and thank you so much for joining me again. And I do hope you'll be able to join me next month. Also, any questions you have in between the seminars, remember the blog comes out every Wednesday, but if you are facing specific challenges and you would like to discuss, you know, the impact on your country, I love having those conversations because it's really good to get a handle on where everybody's at. And secondly, I'm always just available to give you a bit of advice and in this time, you know, help you out and impart some of my experience and what I think might work for your clinic. So yeah, please feel free to give me an email. Thank you very much.